Alzheimer's disease (AD), also referred to simply as Alzheimer's, is chronic neurodegenerative disease that usually starts slowly and gradually worsens over time. It is the cause of 60 to 70% of cases of dementia. The most common early symptom is difficulty in remembering recent events. As the disease advances, symptoms can include problems with language, disorientation including easily getting lost, mood swings, loss of motivation, not managing self-care, and behavioral issues. As person's condition declines, they often withdraw from family and society. Gradually, bodily functions are lost, ultimately leading to death. Although the speed of progression can vary, the typical life expectancy following diagnosis is 3 to 9 years. The cause of Alzheimer's disease is poorly understood. About 70% of the risk is believed to be inherited from person's parents, with many genes usually involved. Other risk factors include history of head injuries, depression, and hypertension. The disease process is associated with plaques and neurofibrillary tangles in the brain. Probable diagnosis is based on the history of the illness and cognitive testing with medical imaging and blood tests. To rule out other possible causes, initial symptoms are often mistaken for normal aging. Examination of brain tissue is needed for definite diagnosis. Mental and physical exercise, and avoiding obesity may decrease the risk of AD. However, evidence to support these recommendations is weak. There are no medications or supplements that have been shown to decrease risk. No treatments stop or reverse its progression, though some may temporarily improve symptoms. Affected people increasingly rely on others for assistance, often placing burden on the caregiver. The pressures can include social, psychological, physical, and economic elements. Exercise programs may be beneficial with respect to activities of daily living and can potentially improve outcomes. Behavioral problems or psychosis due to dementia are often treated with antipsychotics, but this is not usually recommended, as there is little benefit and an increased risk of early death. In 2015, there were approximately 29.8 million people worldwide with AD. It most often begins in people over 65 years of age, although 4 to 5% of cases are early onset Alzheimer's. It affects about 6% of people 65 years and older. In 2015, dementia resulted in about 1.9 million deaths. It was first described by, and later named after, German psychiatrist and pathologist Alois Alzheimer in 1906. In developed countries, AD is one of the most financially costly diseases. Signs and symptoms. The disease course is divided into 4 stages, with progressive pattern of cognitive and functional impairment. Pre-dementia. The first symptoms are often mistakenly attributed to aging or stress. Detailed neuropsychological testing can reveal mild cognitive difficulties up to 8 years before person fulfills the clinical criteria for. Throughout the course of the disease, depressive symptoms, irritability and reduced awareness of subtle memory difficulties are also common. The preclinical stage of the disease has also been termed mild cognitive impairment (MCI). This is often found to be transitional stage between normal aging and dementia. MCI can present with variety of symptoms, and when memory loss is the predominant symptom, it is termed amnestic MCI and is frequently seen as prodromal stage of Alzheimer's disease. Early in people with AD, the increasing impairment of learning and memory eventually leads to definitive diagnosis. In small percentage, difficulties with language, executive functions, perception, agnosia, or execution of movements, apraxia, are more prominent than memory problems. AD does not affect all memory capacities equally. Older memories of the person's life, episodic memory, facts learned, semantic memory, and implicit memory, the memory of the body on how to do things, such as using fork to eat or how to drink from glass, are affected to lesser degree than new facts or memories. Language problems are mainly characterized by shrinking vocabulary and decreased word fluency, leading to general impoverishment of oral and written language. In this stage, the person with Alzheimer's is usually capable of communicating basic ideas adequately. While performing fine motor tasks such as writing, drawing, or dressing, certain movement coordination and planning difficulties, apraxia, may be present, but they are commonly unnoticed. As the disease progresses, people with AD can often continue to perform many tasks independently, but may need assistance or supervision with the most cognitively demanding activities. Moderate progressive deterioration eventually hinders independence, with subjects being unable to perform most common activities of daily living. Speech difficulties become evident due to an inability to recall vocabulary, which leads to frequent incorrect word substitutions, paraphasias. Reading and writing skills are also progressively lost. Complex motor sequences become less coordinated as time passes and AD progresses, so the risk of falling increases. During this phase, memory problems worsen, and the person may fail to recognize close relatives. Long-term memory, which was previously intact, becomes impaired. Behavioral and neuropsychiatric changes become more prevalent. Common manifestations are wandering, irritability and labile affect, leading to crying, outbursts of unpremeditated aggression, or resistance to caregiving. Sundowning can also appear. Approximately 30% of people with AD develop illusionary misidentifications and other delusional symptoms. Subjects also lose insight of their disease process and limitations. Anosognosia. Urinary incontinence can develop. These symptoms create stress for relatives and carers, which can be reduced by moving the person from home care to other long-term care facilities. Advance during the final stages. The patient is completely dependent upon caregivers. Language is reduced to simple phrases or even single words, eventually leading to complete loss of speech. Despite the loss of verbal language abilities, people can often understand and return emotional signals. Although aggressiveness can still be present, extreme apathy and exhaustion are much more common symptoms. People with Alzheimer's disease will ultimately not be able to perform even the simplest tasks independently. Muscle mass and mobility deteriorates to the point where they are bedridden and unable to feed themselves. The cause of death is usually an external factor, such as infection of pressure ulcers or pneumonia, not the disease itself. The cause for most Alzheimer's cases is still mostly unknown except for 1% to 5% of cases where genetic differences have been identified. Several competing hypotheses exist trying to explain the cause of the disease. The genetic heritability of Alzheimer's disease and memory components thereof, based on reviews of twin and family studies, ranges from 49% to 79%. Around 0.1% of the cases are familial forms of autosomal, not sex-linked, dominant inheritance, which have an onset before age 65. This form of the disease is known as early onset familial Alzheimer's disease. Most of autosomal dominant familial AD can be attributed to mutations in one of three genes, those encoding amyloid precursor protein (AP) and presenilins, and 2. Most mutations in the AP and presenilin genes increase the production of small protein called a beta-42, which is the main component of senile plaques. Some of the mutations merely alter the ratio between a beta-42 and the other major forms, particularly a beta-40, without increasing a beta-42 levels. Two other